Adults with PKU that have been on long-term dietary therapy in Ireland are approximately 58 years of age. So newborn screening came about in 1966 in our country. And unfortunately, and this is not just in Ireland, but in other countries too, we have a lack of resources for adult care in Ireland and in other countries. So we require additional support around consultants. We require additional support, particularly in the area of psychology support to help patients with their diet. Because as Susan Wasburn, who's a neurocognitive scientist from the States, she says that we are blaming the victims because for different reasons people may have elevated levels, and it's not just lack of adherence to dietary therapy. They may also have issues due to stress. Managing their diet, menstruation affects it. Illness is another thing that can impact the diet, but also the lack of variety of medical foods in different countries too can be an issue for patients. But one thing we haven't looked at is, as Susan Wasburn I mentioned, is the fact that we're blaming the victims because when they have elevated Phe levels, it affects their ability to plan and to organize, and these are the very skills that are required to manage and adhere to the diet. So I feel if adult patients had support to help them to adhere to the diet, it would be hugely helpful. Another area of psychology I think for parents would be very important. I attended a conference recently where it spoke about emotional regulation for the healthy development of young children in general. So in the first 3 years of PKU, it's very, very stressful for parents actually learning about the diet, administering the diet with a toddler who's teething or going through vaccinations, and they double in length in the first year. So their protein requirements vary so often and so regular. So very often for parents, this is a very challenging time. And I've met families who, when they speak about PKU, they get quite emotional. Yet on the outside, they seem to be managing quite well, and they seem to be quite dismissal of their experience around the support that they may require. And I think this is an issue too, and it is something that needs to happen because the research now demonstrates that if young children don't have parents who can emotionally regulate quite well around them, this has implications for their long-term mental health as well. So psychology is a huge area in PKU that needs to be addressed. I think most of our clinics should be actually psychology-led. I have huge admiration for the dietetic teams and the nursing staff, metabolic nursing staff in these metabolic centres, but I hugely believe that it requires more presence of psychology to support the community.